First of all, thank you so much. For those of you who are here in person and those of you who are online, we're grateful that you guys have joined us tonight. Tonight is a special and extraordinary evening because what we're going to share with you tonight is the journey of Anthony Clay, who is Dr. Johnson's assistant and also known as Fit Papa. Okay, so we're going to share his journey because there were a few times over the last couple of years that we almost lost him. And so I'm going to have Dr. Johnson obviously go more into the story. We've got Leo here tonight. He's going to share his role in the process. But as you know, Amen Clinics has been around for 35 years, and we love partnering with all of you guys in collaborating care because Dr. Amen started a brain health revolution several years ago, and we have all jumped on the bandwagon, and we're here to support each other and share each other's stories and share modalities and treatments that can help all. So without further ado, I'm going to introduce Dr. Johnson.
Thank you so much, Lisa Marie. Yeah, it is indeed an honor for me to be here this evening. Um, you know, I came to the Amen Clinic about 4.5 years ago, and I'll tell you what, I really enjoy coming to work every day. I truly believe in the mission of the Amen Clinic, all of the work that we do. But the one thing that makes it absolutely a great place to work on a daily basis is an absolutely phenomenal team that I get to kind of share my journey with. And so tonight, I think it's really great that we have an opportunity to talk about the processes that we do for our patients, but also an opportunity to talk about those people behind the scenes that really do so much of the work that really helps to benefit our patients. Um, and certainly tonight we're going to talk about Anthony's journey, but Anthony Clay is here to my right. And if you can see him, let's see if I can kind of turn here. All right. Anthony is certainly my personal assistant, but as a senior patient care coordinator, his role is just so enormous, I think, on a day-to-day basis. And as he interacts with patients and from the very front of the office to running to the back and taking care of so many things and coordinating much of what we do on a day-to-day basis. And and in order for him to do that, I think that Anthony's commitment, not only to his job, but his commitment to his health and wellness so that he could do his job is really the story that we're going to talk about this evening. We also have Leo Owadisian, if I pronounce that correctly. All right. And Leo is actually a patient outcome manager. And this is also an opportunity this evening to introduce that role. And it's one that I think that it is absolutely necessary for all of us to do our jobs because when our patients come to us, at least when they come to me, they're always amazed at how much I already know about them. And that is because of the work that the patient outcome managers do. They really spend an enormous amount of time with each of our patients to gather that history, but not just a regular history of present illness. They really go into such great detail, and that really allows us to fully identify the underlying issues of our patients. And then as they go through the scans, we're able to then correlate that history with our findings, and that makes a big difference. So tonight, Leo's had the opportunity to spend a great deal of time with Anthony to really get his back history. And we're actually going to begin this evening with that portion of the journey as Leo begins.
Okay. Thank you, Dr. Johnson. So I am a patient outcome manager at Amen Clinics. I had the great opportunity to conduct a history appointment with Anthony a few months ago. And just to go over a quick synopsis of kind of my role in the clinic itself, I'm hesitant to say the most important part of my job, but definitely most time consuming is conducting these history appointments and creating reports for physicians like Dr. Johnson to have prior to meeting with patients. I would say my role starts weeks, even months before meeting with patients for history appointments through welcome calls and kind of guiding patients through our intake process, which can be extensive as we're gathering as much information as we can before they meet with these physicians. The process also extends past the history appointment itself through aftercare appointments, during which we go over the evaluation that the doctor gives each patient. This can be an overwhelming process, right? You're getting a lot of information from brain scans to treatment plans. It can be quite overwhelming to receive at first. So a few days after these appointments, we feel it necessary to go over that information again, just to make sure they understand and kind of make sure we're on the same page as the patient, make sure we understand what parts they're incorporating, and if the treatment plan is, targeted enough for each individual. Specifically in the history appointments, we like to follow a biopsychosocial and spiritual methodology for history information gathering. To begin with biological information, it can stem from medical histories, both personal and family histories, as well as looking into the important factors such as sleep habits, diet, and even exercise, as well as looking into patients' current exercise regimens. Next, looking into psychological information, of course, looking into current symptoms and maybe how previously they fluctuated throughout their past, as well as looking into prior attempts in psychiatric and therapeutic visits, right? We want to understand, does the patient have a good history with psychiatrists in the past, or is there some trouble going there, so we can know how to effectively handle each and care for each one of our patients. Social information can stem to who are they living with? Are they living with family members, their job and occupational history, and schooling history? And finally, looking at their spiritual information. Not only is this, can this be religious information, as not all of our patients are religious, but also kind of what's each patient's purpose, right? What's their driving factors in life? So these history appointments are 2 hours long. We go over a lot of sensitive and kind of touching information with each patient, but we make sure that they feel heard and, after each appointment, feel like they can have some hope for some change and positive change to be made in their lives.
The excellent job. Excellent job. I as I listen to many of my patients in feedback, they often say the very best part of their experience at the Amen Clinic is actually with the patient outcome managers. That first impression and is one that's just so very important for the work that we do. Establishing that level of trust and connectivity is so instrumental in terms of really improving a wonderful outcome. And then, of course, the day-to-day point of contact is certainly with Anthony. Now, Leo, I wanted to ask, in your experience in kind of starting with Anthony, what did you learn initially?
Well, he was a great guy to talk to. We really talked about in our history, focused on his physical health previously, learned that he was growing up in a community where he was exposed to drug and alcohol use at a very young age. And this kind of affected his life choices kind of later into life. And that was one of his main focuses, seeking care at Amen Clinics and seeking care through Dr. Johnson as well. We also talked about past difficulties with sleep. He has presented with chronic issues with sleep, past sleep issues as well as struggles with type 2 diabetes. So that was kind of the main things that we talked about.
Excellent. And Anthony, how was that experience for you?
It was good. I'm like an open book, so Leo was, warm and welcoming. We already had talked prior to this, so being able to open up to somebody and listen and took all the information down. It was a good process. It was
Good.
okay with me.
Is there anything specific that you'd like to add related to your background, your history that you think might be really relevant to what we're discussing this evening?
I mean, yeah, just a part of change. I realized when you're changing, you need a good community around you. And I mean, that's what I found at Amen Clinic. I picked out a lot of bad habits at an early age because I thought they were good habits, but
Mhm.
I got trained to seeing things like, go through the week, a good Friday, you see people having a drink, people celebrate, you have a drink. So I kind of picked up those habits at a young age.
Mhm.
So when I finally realized, I heard a voice that said enough is enough. So I said, let me use my resources around you. And then, I mean, Amen Clinic found me basically. That's what I always say. I tell Miss K that. Amy Clinic found me, so I had a good support system around me, and I just started making that change. So,
Good,
yeah.
good. Right. As we go through this process, um, one of the things that I'd like to kind of share is that just kind of beginning with the end in mind, um, we put together a very comprehensive document for our patients, which kind of identifies or kind of outlines this whole process from beginning to end. Certainly beginning with that very detailed history that Leo provided. And I'm just going to kind of pull this up, and then I'll share my screen with you guys, and we'll kind of talk about that document. And let's see if I can kind of share this now. Good deal. Hope that you guys can see this, and I hope that the print is large enough for everyone to see. But in doing the final evaluation, we actually, um, capture all of the things um, that Leo and Anthony have certainly talked about, and I just wanted to kind of highlight a couple of things that they were saying that in this process, Anthony presented with a very long history of kind of alcohol and drug use, as well as poor dieting. And I think that, certainly Anthony's motivation in terms of coming to the Amen Clinic was that motivation to change that lifestyle because he realized that because of some new chronic health conditions like type 2 diabetes, um, difficulty breathing, even pulmonary edema, just really necessitated the that change to occur. And following an acute hospitalization, it was necessary to make some changes. And so, in utilizing the resources here, I think that he made that concerted effort to in fact change. And so, we're going to kind of talk about kind of a before and after. What his brain looked like before that change began, and then subsequent changes and from that. Now, to kind of better explain this, before we show you Anthony's scans, I wanted to kind of show you a couple of baseline scans so that we have some sense of normal. So I'll actually present that first. So the first scans that we're going to look at are actually those of a 20-year-old young man from our archives. And we kind of see this as a healthy surface view. Now, when we talk about the outer surface part of the brain, that outer surface is what most people think about as the gray matter, if you will, of the brain. Because certainly when we fix brain tissue in a lab, it turns gray, and so it's always been called that. But actually, the gray matter is really the neocortex. And the neocortex of the brain is really the thinking part of the brain, certainly where we do calculations, where we formulate thought, where we process information. All of the things that you read, things that you see, even things that you hear would be processed here in this outer surface. Now, the camera on the scanner is able to kind of move around to different angles. In fact, when someone's lying flat on their back in the scanner, we're taking tons of pictures from many different angles, and all of those are seen by the radiologist. But today we're going to focus just on four principal views to give you a three-dimensional perspective of the brain. The first view that we typically begin with is in the lower right-hand corner. And this is actually called a top-down surface view. And this would be certainly as if you were kind of standing behind someone looking on top of their head. And so it's kind of that bird's eye view, if you will, in which this top part is really the frontal lobe of the brain right behind the forehead. In fact, it's known as the prefrontal cortex. And the prefrontal cortex is really that part of the brain that's principally responsible for attention, concentration, and focus. In fact, when most people think about those hallmark symptoms of ADD or ADHD, it's generally this frontal lobe that most people are thinking of. Now, opposite the prefrontal cortex, in the very back of the brain, is actually the occipital lobe. And the occipital lobe is principally responsible for really processing visual information. So literally all of the things that we see. Now, certainly when we think about vision and that process, kind of begins with the eyes in the up front, and certainly the retina, the optic nerve, all of which is kind of in the front part of the skull. But nevertheless, as we process vision, it's actually done in the very back of the brain. Now, the sides here are actually the parietal lobes, here and here on either side. And the parietal lobes are principally responsible for memory. Now, certainly one's ability to recall recent and past information, but also emotional memory, one's ability to recall how you felt during different events and circumstances in your life. Now, in addition to memory, the parietal lobe is also home to the somatosensory cortex, which is actually very much like the way it sounds. It really has to do with all of your senses. Certainly things like your sense of touch, hearing sensitivity, but also things like position sense, which is known as proprioception, which of course is that ability to know where your body is in space and time and rotation. So whether you're an astronaut floating in outer space or if you're just an 8-year-old little boy turning flips on a trampoline, it's that ability to know where your feet are in that rotation so that you can land upright. We have a couple of side angle views. In the lower left-hand corner is a left-sided surface view where the prefrontal cortex is actually facing the left. And in the upper right-hand corner is a right-sided angled view where the prefrontal cortex is actually facing the right. Now, both of the side angles are really wonderful views for really that parietal lobe that's, again, so important for memory as well as that somatosensory cortex. Another opportunity to see the occipital lobe for processing visual information. And then, of course, this is our first opportunity to look at the temporal lobe. And the temporal lobe actually sits kind of in a recessed area of the skull known as the fossa. And the temporal lobe is really important for things like language, but certainly in Broca's areas, reading comprehension, auditory processing. And the temporal lobe is also home to both the hippocampus and the amygdala. And both of those structures are very much involved in mood regulation. So much so that we kind of often think of the temporal lobes as in temper management. Now, we also have an underside view that's really taken from a very unique angle. Literally, at one point, the camera of the scanner is actually at the angle of your chin, looking underneath the head. And so we really have this unique view of the temporal lobes when they're side by side, so that we can really appreciate the symmetry of those temporal lobes. And then that's a really, really important perspective. The underside view also affords us another opportunity to look at the prefrontal cortex, but from underneath. And this is the part of the prefrontal cortex that's actually nearest the eyes. And so it's often referred to as the orbital or periorbital prefrontal cortex. And that's going to be really important for our discussion today. Now, the good news is that, for even though we go through all of this detail with our patients, we also are able to provide specific handouts like the brain systems handout, which is certainly one of my favorite tools to share with patients. It's a very nice document that really outlines all of these brain systems and gives a wonderful description of each of the brain regions and how they function, and even if they're not functioning well, what to look for. So it's a very useful document in that regard. Now, and I always share with my patients that when they look at that brain systems handout, most of the images or all of the images are actually in black and white, which always reminds me to tell them that even though the camera of the scanner is able to generate some very colorful images, the colors here really don't matter. What's really important is really all about surface contour and symmetry. And so I always explain to them that this is really all about blood flow and circulation. And so when we see nice, smooth surfaces, that's really indicative of good continuous blood flow and circulation. And certainly symmetry as it relates to those paired structures like the temporal lobes. Now, in addition to looking at the neocortex of the brain, we're also able to look deeper into the brain at the limbic system or the emotional part of the brain. Now, as we go deeper into the brain, to these limbic structures, this is actually where color really does matter. And the significance of the color here is that um, and again, this is all about blood flow and circulation still, but all of the areas in dark blue and black represent areas where there's a lower blood flow and brain activity level. The areas in red represent areas of an increase in blood flow and brain activity. And finally, the areas in white represent really the highest level of blood flow and brain activity. And we often think of those as white hot. Now, in general, these are known as active views because of that concept that blood follows activity level. Or another way of thinking of that would be the most active parts of the brain are really those that really receive the largest amounts of blood flow. Now, that being said, typically the most active part of the brain is actually found at the base of the brain, at the very bottom. And the structure that I'm circling now is actually the cerebellum. The cerebellum actually sits just beneath that occipital lobe, but actually above the spinal cord. The cerebellum by size is relatively very small. It's only about 12 to 14% of the total surface area of the brain, yet the cerebellum contains over half of our neurons. And the reason is the cerebellum is really that part of the brain that keeps us alive. It's responsible for our breathing rate, heart rate, and also things like coordination and balance. Now, the cerebellum is also really important for higher order processes like sequencing, planning, organizing. In fact, the cerebellum is really responsible for sending multiple projections or neural connections to all of those other brain regions that we talked about. And in fact, the cerebellum, in working specifically in concert with the prefrontal cortex, is really important for really executive functioning, including things like impulse control. And so that part is absolutely crucial. So we'll talk a lot about that today. So as we kind of go through all of this anatomy, we can then kind of share this specifically with our patients. And as we kind of use this as a background, we're going to kind of talk about Anthony's brain now. And I'm going to kind of clear this out. And what we'll do is kind of talk about the outer surface part of the brain first. So I'll kind of minimize this, and we'll use this healthy surface view first. Now, the great part of this evening is that we have two sets of scans for Anthony. The first set was actually done 2 years ago in July of 2023. And I think that was around the time that you first started working here, right?
Just around,
Yeah.
maybe like a year, almost a year in.
All right. So that was not, there was probably not a lot of change in terms of behavior and lifestyle. So we're going to kind of see first how Anthony's brain looked when he was still actively engaged in that previous lifestyle. So let me kind of move this one over, and I'll bring up his. All right. And this is that first scan. All right. Now, as we kind of look at this, we can immediately see this is certainly a brain that we really want to help. And I think that if you kind of compare this side by side, you can certainly see that there are a number of things we really want to address. Now, Anthony, when you first look at this, what are your initial thoughts?
Ooh. Um, the choices I made. I mean, this is. I was scared for a long time to get my brain scanned up here when I first started working, because I was scared to see the outcome from it. But now that I'm looking at it, I was just like, it's just me saying the wrong lifestyle, led to that. So yeah.
Well, it's certainly a brain that looks very toxic, and what I mean by that are, instead of having the surfaces that are very, very smooth,
Yeah.
um, the surfaces here on yours are very rough. In fact, the radiologist would characterize this as kind of scalloping. I think they use the term because they liken it to scalloped potatoes. But nevertheless, certainly this is a brain that looks pretty rough. Certainly a lot of the scalping can occur with aging, but there are a number of things that can also cause that. Um, and we think of it in terms of neurotoxicity, and those things that would specifically be neurotoxic would certainly sure. Would certainly be things like pesticides, chemicals, lead, carbon monoxide, even things like mold, but typically those environmental toxins that we all try to avoid. But also voluntary toxins like drugs, alcohol, illicit substances. Those are all things that can be very neurotoxic to the brain and actually cause a lot of inflammation. And certainly when we think about many things that are available on the in our society, certainly things like cannabis, um, other things that people take for granted, things like kratom, I think is really significant, and I see that a lot in patients and like many of my 17-year-olds who come in for scans. Um, who actually show evidence of a lot of neuroinflammation. But nevertheless, I think that, and certainly, of course, alcohol is actually a significant neurotoxin. And these are all things that we want to try to gradually eliminate. And I think that certainly as Anthony has done so, it's actually shown to be very, very effective in improving his overall health and wellness, but also his brain health, which I think really makes a huge difference because our goal in treatment, of course, is to make sure that our brains survive as well as the rest of our bodies. Now, there are some specific areas here also. Just globally, I think that there's certainly evidence of neurotoxicity. But when we look at some specific regions, they're also affected as well. Especially when we look at the underside view, certainly beginning here in the prefrontal cortex, there are a number of areas that look like holes. And Anthony, those areas that look like holes doesn't mean that they're actual holes in the brain, but because this is really about blood flow and circulation, these are areas where there's a greater than 35% reduction in blood flow and circulation. And so the area in the prefrontal cortex is definitely an area that we want to improve, but also those temporal lobes are really, really affected. Now, these particular scans are done following a task that involves sustained attention and focus. And so while your brain is trying to perform this task, we have this diminished blood flow and circulation that really has a negative impact there. Now, I think that's probably hard to believe because I know that on a day-to-day basis, when you have so much to juggle, and I see you as someone who is um, kind of right on target. As patients communicate their thoughts and feelings, you don't ask them to repeat that. Instead, you're able to I just need to kind of see if I can do this real quick. All right. All right. So as I was saying, you know, in real life, I see Anthony as someone who is very attentive, very focused, certainly capable of managing lots of different things at one time. But nevertheless, I think that effort is probably at great impact to his brain. And so that's really what this is showing. Now, the temporal lobes are certainly also involved, especially in things like memory, as I said before, reading comprehension, auditory processing, but also mood regulation as well. And so, our goal in treatment is certainly to improve all of that blood flow circulation, so that these areas are able to continue to function, um, long into your later years. So without a doubt, you have tremendous brain capacity, brain reserve, but we just want to make sure that you're able to still maintain that. And so, utilizing specific things, I think, can really help to eliminate the neurotoxins.
Yeah.
And I think we'll see shortly just how far you've come in terms of doing that. Okay. All right. So let me show you where his brain is now, and we're going to kind of talk about that. So let me see if I can kind of clear this out real quick. So the scans on the left are actually the scans from 2023. The scans on the right are the most recent scans in 2025. And you can certainly see the difference in terms of just the surface contour. Now, there's still some things that we have to work on, but overall, the surface contour is so phenomenally different. Okay? So significant yeah. Oh yeah, yeah. So much of the evidence of that neural inflammation is really gone. Okay. So the brain in general looks so much healthier. Okay. And I think that just the efforts that you've put in terms of nutrition, exercise. Do you want to talk about some of the nutritional changes that you made?
Oh, yeah. Well, we started off here, and when I say everybody here, motivates you, you get your small victories. So I started off doing the protein powder in the morning time, and I'll make that shake, and I'll add a scoop of Neuro Green, and then sometimes I even might add a banana to it with we have everything here, the almond milk. So really, I just told myself, if I gotta be healthy for 8 hours at work, that's 40 hours a week. Let me see if I can do it, at home too, and then start paying off. So we have all the resources here. So I started off with the shakes.
Mhm.
I started off with a scoop of Neuro Greens around lunchtime too, as well, with like 8 ounces, 10 ounces of water too.
Mhm.
And then I just start watching what I eat, day in and day out. Some of the people at the job knew I was like one of the ones. I used to be like the food runner. I didn't want to eat by myself. So I say, hey, I'm gonna pay for your food too. Then we just start doing everything healthy. So when you have 2 to 3 more people doing it with you,
Mhm.
they hold you accountable. So that was just one of my big things. So, I just stuck to it. And then I start
Excellent.
exercising. Me and Ahalam will go walking on lunch break sometimes around here, walking around 2 times is a mile. So if you add that into a week, at least 3 times, you're doing 3 miles more than what you were doing. And then from there, once it started going, I start working out every day, five times a week, and then just eating right.
Sure. Excellent.
Yeah.
Good job. Good job. So we can certainly see just in your brain uh, those those great changes. Yeah, man, we are so very proud of this.
Appreciate you.
All right. Now there's still some areas that we're concerned about. When we look at that prefrontal cortex, still there are these areas that really look very large, especially when you're trying to focus and concentrate. And when we see that, it's actually often consistent with the diagnosis of actually attention deficit hyperactivity disorder. Quite often in our patients that struggle with ADD or ADHD, even though everything else is looking much better, if we're still having problems with diminished blood flow and circulation in that prefrontal cortex, it's often related to the ADD. And so there are a few other things that we can do. In terms of natural supplements, we offer one called Focus and Energy. Focus and Energy is really a very nice combination of things like green tea extract, um, a series of adaptogens, and like sensoril, ashwagandha, choline, and this rhodiola. And this combination really is a non-caffeinated way to really improve that blood flow and circulation to this part of the brain. And so that could be very, very helpful. Um, and I think it's certainly a nice alternative to psychostimulant medications. Okay. And we'll kind of talk about that shortly as well. Because typically when someone experiences these particular changes, and if that correlates with real life problems with inattention, poor impulse control, hyperactivity, first line treatment for many doctors would be one of the stimulant medications, psychostimulants like Ritalin, Dexedrine, Adderall, things of that nature. And we're actually going to talk about why that would not be a good choice for you. Okay. Now, I think also the other impact here is really very, very low activity within those temporal lobes. And that can have a major impact in things like memory, but also mood dysregulation even. And so we definitely want to do all that we can to support blood flow and circulation here. But even though things are much, much better, I think additional things like Brain and Body Power Max would be really helpful. Brain and Body Power Max is a combination of multivitamins, minerals, omega-3 fatty acids or fish oil, as well as things like phosphatidylserine, ginkgo biloba, and even about 600 milligrams of N-acetylcysteine, which really is very, very helpful for continuing to remove a lot of those neurotoxins from the brain. So that really would be my best recommendation. Okay. All right. So I'm going to kind of clear this out, and we're going to talk about what's going on in those deeper regions of the brain. So for this, I'll just pull up, let's see, I can move this out of the way. There we go. All right. So I'll bring this up as an example. This is actually our healthy active view. Just as a reminder, remember, this is where color really does matter. The significance of the color here is that all of these areas in dark blue and black are kind of areas of low blood flow and low brain activity. Now, when we're thinking about the emotional part of the brain, we actually like to see a lot of blue and black because it means that that part of the brain is pretty calm. Now, we certainly like to see a lot of high activity in the cerebellum because it's so important for that autonomic functioning, but also so important for those higher order processes. So it's always really important for this to be, for the cerebellum to be very active as well. Let me see if I can move this over, and I'll bring up your scan initially. Okay. All right. So this first scan that we're looking at for Anthony is actually from 2023. And as we look at the limbic structures, there's certainly a lot of areas of blue here, but there are also some, fairly low areas around the cerebellum. In fact, the cerebellum is really here. Now, the area above that is actually a part of the brain that's actually known as the posterior cingulate. And so much of what you're seeing in here that looks white hot is really above the cerebellum in the posterior cingulate. Now, the good thing about the posterior cingulate, again, from the side angle, it's here. The posterior cingulate actually contains a default mode network. And that's a part of the brain that's responsible for kind of deep thought, self-reflection, contemplation. And so when we see a lot of high activity there, that's actually a good sign. Okay. And, we typically see this in patients who are actually of high intelligence, just being able to have that self-reflection. All right. All right. But certainly other areas of concern, like if the cerebellum is down here, above that is actually your thalamus. The thalamus is actually a deep limbic structure that's responsible for the regulation of mood. And when we have a white hot thalamus, it's often consistent with some mood dysregulation. Sometimes related to mood swings, irritability, low frustration tolerance. And so we always like to kind of calm that part down. Okay. So all of this part that's kind of right here in the middle, we really like to kind of calm that down. And so, you know, the and we're going to talk about how that changes. But certainly, this can certainly represent, a past history of a lot of maybe chronic sadness, chronic mood changes. Okay, let me kind of clear this out for you, and I'll move this over. And here's the next one. And this is really, really an interesting slide because this next one is actually the most recent one in 2025. Okay. And and this actually tells me a lot. Okay. All right. So let's kind of point out a few things here. Um, so by comparison, they really look very, very different. Okay. Um, and we're gonna just kind of break this down a little bit. Again, the cerebellum is down here, but really from the side view, you get a better understanding of there. There's that posterior cingulate and even probably the middle cingulate as well here. Now, but again, above the cerebellum, you have still this white hot thalamus. And once again, the thalamus is that deep limbic structure that's responsible for mood regulation. Now, that's white hot, but also the other thing that's very different is you have overactive basal ganglia as well. Now, the basal ganglia are really three nuclei of the brain. They're the caudate, the putamen, the nucleus accumbens. And they're all very important and do different things, but the part that we're seeing that I think that's really white hot is actually the caudate nucleus of the basal ganglia that's really responsible for underlying anxiety symptoms. Things like chronic worry, nervousness, increased tension, sometimes feeling easily overwhelmed. We'll sometimes see that as well. And then on top of that, you also have the anterior cingulate that's actually very prominent now that we didn't see before. The anterior cingulate is also a part of the cingulate gyrus. So the cingulate is really a thin layer of brain tissue that sits between the right and left hemispheres of the brain. In fact, the cingulate runs along the top of the corpus callosum, which is that giant band of nerves right in the center of the brain that allows the right and left hemispheres to communicate. That's really significant because, in women, that it's a lot larger than in men, which is why women are able to multitask and men just aren't. But nevertheless, the cingulate runs along the top of that, very much like a thin mohawk. And the front part is the anterior cingulate, which actually kind of functions as kind of the gear shifter. It actually sits kind of just behind the prefrontal cortex. And of course, if you remember, the prefrontal cortex is so important for attention, concentration, and focus. Well, the anterior cingulate kind of functions again like that gear shifter, allowing us to shift attention, to shift focus, to make transitions in thought. And when you have an overactive one, it means that that gear shifter is getting stuck. Okay. Now, overall, when we look at these limbic structures of the emotional part of the brain, we would think, gosh, we really want to calm these down. Now, if this is paired also with kind of low functioning in that prefrontal cortex, um, if a doctor decides, well, we'll just give you a stimulant medication, the stimulant medication can certainly improve blood flow and circulation, even the release of dopamine in that prefrontal cortex, but it actually can make all of that worse. Yeah, so that's not a good choice. Instead, we try our best to kind of use natural ways to calm this down. And more importantly, I think I think in your best interest to really understand this so that we can figure out the underlying cause. Now, one of the things that we've learned here at the Amen Clinic is that sometimes these particular changes in the brain really represent a lot of things that have happened in the past. Okay. In fact, the pattern that we're seeing here is called a diamond. And the diamond, let's see if I can kind of draw this. There we go. The diamond is that overactivity of the anterior cingulate, the basal ganglia on either side, as well as the thalamus. And the diamond pattern is one that's consistent with past emotional trauma. And it's one of those things that, again, you're a very high functioning individual. In order to do all of the things that you do on a daily basis here at work, but also in your personal life, I think that it's really probably very important for you to kind of find ways to kind of not deal with this, you know? And I think that probably like so many of us, we've become really, really good at really suppressing that past emotional trauma so that it's not even there, you know? In fact, I have a patient that I just saw today that kind of talked about that in terms of the effort in terms of understanding that past emotional trauma as an excavation of her former self and really taking the time to utilize therapies to actually really understand this so that those issues are resolved. And certainly things like cognitive behavioral therapy, but especially trauma-based therapies like EMDR can be extremely beneficial. And we refer a lot of patients for EMDR. Okay. All right. And so you probably know exactly who to go to. All right. All right. Maybe even a few people here. All right. But this is the part that really is so important. So, we know that, as a medical doctor, our first job is to, or our first thought is to pull out a prescription pad and start writing prescriptions for things like this. But we know that the real truth is, cognitive behavioral therapies and EMDR really are the treatment of choice for helping to calm down these overactive limbic structures in the brain. Okay. Yeah. So that's the work that we have to do. Okay. All right. So I've put together a treatment plan for you that certainly includes really continuing all the efforts that you've already done. Those things of nutrition, exercise, that wellness program, but also additional supplements like the Brain and Body Power Max to address um, just overall health and wellness, but even those specific things to calm down the overactive limbic structures too. Right. All right. I'd very much like at this point to kind of open things up to the audience. Lisa Marie, I may need your help if there are questions from those people at home. Mhm.
So, we're going to have an echo for a minute. So for those of you guys online, if you want to go ahead and put your questions in the chat, and then we can go from there. And then of course here, yeah, absolutely.
So, I find it really fascinating that 2023 has, so the changes in his brain activity has changed, even though his life, like the structure of his brain has gone better. So what do you think might have caused the transformation and the overactivity in those areas as is, as he's made significant improvements. Because the trauma was always there,
Yes,
right? So
right.
how did it all of a sudden now coming up versus it didn't show up in 2023?
Right. Do you want to start?
Yeah,
Now, and I'll tell you my opinion as well.
I mean, all honesty, and when I was making the lifestyle changes, like dieting to getting right, um, I was still like just struggling with other things, like I never said this, like with different anxiety. I used to go into Miss K office and kind of talk to her. She was my therapist up here, and I was having a lot of heart to heart with her before. And then one of the biggest things was while I was changing, I used to tell Miss K like I'm afraid because this lifestyle, like, and the other thing, like when you change, you have to let things go. And I wasn't really ready to let go. And I used to talk to her and say, man, it's family and friends. And I used to go home, and even though I'm here, everybody knows me for being the happy guy here. I'll smile, I make everybody laugh. But I used to kind of go home, and I don't even know if to say kind. I used to go home and just think about it at nighttime. And it was stressful, just friends from 10 years and 12 years. It could because where I'm heading to and where I was going, I knew who I had to let go and what else I had to do. So I truly believe that's what it was, because when I got scanned that whole week before the prior week, and I was moving and just dealing with other situations and things like that. So I think, and then the other one, I really didn't have any kid, any major care, because I used to kind of, put it in the cup and drink and let it at ease. So that's what I think it was.
Right. And let me explain it in maybe a different way.
Okay.
All right. Okay. I think like so many of our patients, um, you know, people often use substances as a way to self-medicate. And I think that self-medication that we see primarily in terms of the neurotoxicity in the earlier brain was also serving to really numb the emotional part of the brain to a great degree. But certainly with the lifestyle change, eliminating those things that were once just shutting down the limbic structures, with that being gone, now we can actually see what's going on underneath. Mhm.
I was gonna say it like that.
Yeah.
Yeah.
Mhm.
Would this change on a daily basis?
So I don't think so. I don't think so. I think it really does take some time. I think when we look at the outer surface part of the brain, because again, that's really blood flow circulation, I think that there are probably um, more rapid changes within the neocortex based on those things. But when we look at deep into the brain, to the limbic structures, I think that I think more of those things are chronic and really require some significant time. Actually, Dr. Sanger was just here and offers a wonderful explanation about the ACEs study that the Amen Clinic actually participated in which, and of course, the ACEs is looking at adverse childhood experiences in adults. And we know from those studies that there are physiological changes in the brain that occur in these limbic structures based on early adverse childhood experiences, and they remain with us and even into adulthood. So those don't change very quickly, but they do change when we actually address those issues with cognitive behavioral therapy as well as things like EMDR.
Not familiar with them.
Oh, I'm sorry. It stands for eye movement desensitization and reprocessing. It's really an elegant type of therapy that was developed primarily for individuals struggling with trauma. It actually utilizes a series of devices, sometimes light moving back and forth, sometimes sound like a metronome or even tapping. But the goal is to move the eyes back and forth as someone is actually working through past trauma. And I think psychologically, it allows a kind of separation between that discussion of traumatic events and the emotional pain associated with that. I hope that explanation was okay. All right. Right. Are there other questions?
How long? It's been 2 years and you're gonna keep going.
Well, the beauty of this is that, I mean, I think we can keep going. Those things that I've recommended are certainly things that I take on a daily basis. And I've done so for the last 4 years, and I've actually put my entire family on them as well. So they are safe enough to continue indefinitely. But nevertheless, the Amen Clinic has actually done studies in terms of looking at how the brain changes after only 6 months. And I think that those studies are really quite compelling in terms of showing, the efficacy of many of the natural supplements in terms of improving overall brain health and wellness. Mhm. Yes, ma'am.
Learned over the last 2 years. Does it motivate you to go deeper within yourself to explore things, to kind of look at things differently? Does it motivate you to want to do EMDR? Or like you were saying the week before you got scammed, you were going into that and it was kind of, what's the word? You were like, oh,
Dark place.
yeah.
Mhm.
Yeah, I mean, it definitely does motivate me. I mean, just from where I came from to where I am now, I say it's no going back. So if there's no going back, let's go forward. So if there's things I could do to, heal myself while I have the time, then I want to keep on doing it. Another thing is I just get so many compliments and so many people are proud of me. I don't want to let them down. So I'm doing it for me though. I'm doing it for me always, but it's just everybody who's been motivating me and there for me. I wouldn't want to let them down. So like Dr. Johnson is saying, like I do actually I just start taking the Bright Minds memory powder.
Okay, all right.
So you gotta know, I listen to Dr. Johnson a lot. We talk a lot too. So, I hear some of the things he say. So I have started taking that. I take my omega-3s. I take my Neuralink as well too.
Mhm.
So I mean, I have, so like you said, like of course I do want to get better. So while I have the resources, if he's saying EMDR, like he said, I do have all
That's
the
exactly right.
So yeah, that's good.
Okay. Just for clarification, Bright Minds Memory Powder is really an excellent recommendation. I mentioned Brain and Body Power Max, but Bright Minds Memory Powder really has everything that's in Brain and Body Power Max, except for the omega-3, and you're already doing that anyway. So that's an excellent choice.
Yeah, I just started. I just started last week.
Okay. All right. Any other questions?
I have no questions. I just have a lot of thoughts going through my head. See, this brain structure we got bad.
Yes.
And then when we got over here, like you seen, like some things changed here. Is this when we really work on a person's thoughts and a person? Okay.
Absolutely.
And I want to just congratulate you.
I
too,
appreciate
because
it.
seeing your brain from 2023 to 2025 is amazing.
Thank you.
That gave me hope.
Yes. Yes. And I think that's what we do. I think it really is about hope. And 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 that's so gratifying, I think, for all of us who work here.
The diamond shape, you said that was the anterior,
It's the
Cingulate.
anterior cingulate,
anterior.
the basal ganglia on either side, and the thalamus.
Okay.
Mhm. Mhm.
And just recently, I reached out to Lisa Marie. I'm a nurse practitioner in Gun Barrel City. I don't know if that's happening.
Oh, absolutely.
there to do hospice. And I just see like probably 90% of my patients is dementia, some form
Sure.
of dementia. And I have a strong family history of it. So I want my focus to be on dementia prevention,
Mhm.
of course. And
You know, the interesting thing about the scans is that, we're able to see evidence of dementia often 15 years before the symptoms. 15, 15, 1 5.
I'm thinking I need to do it.
Yeah. Mhm.
When I was going through nursing school, they couldn't even diagnose somebody with Alzheimer's until after the
Yeah.
to do the autopsy.
Mhm.
And now you can see it.
Mhm. Mhm. Absolutely. Absolutely. Lisa Marie?
Um. Okay, well, it's one awareness, not after another. So we're building on awarenesses. So like Anthony's journey and the fact that the diamond pattern showed up after he had started going through all of the things and shedding the weight.
Right.
You know, and so when you start to shed that weight, that's when things pop up.
Mhm.
You know, and so I'm really inspired and fascinated by his journey because what else is going to pop up, along the way, and what else can we face and process and move through and transform? Because I've seen a dramatic transformation, and it's just so inspiring to me to watch.
For all of us.
Thank you, thank you.
Mhm.
Because
How much weight did you?
I'm 230 down 230 pounds.
About 230.
230 pounds.
In 2 years?
Yeah, yes, ma'am, 2 years. Maybe like I think it's been like 19 months. 19 months. Because I started March. 19 months, yeah.
Was that just doing the protocol here? Was it doing like GLP-1s or is it strictly supplement?
No, just eating right, cutting things out. I stopped drinking. Just start eating healthier, working out, staying disciplined.
so, Dr. Johnson, okay, when Anthony started drinking, what does that do to someone's neurotransmitters? Does it change the neurotransmitters in the brain when somebody drinks, or does it change certain parts of the brain?
Well,
What's this like?
Well, alcohol is truly a depressant, and it really depresses all functions of the brain. The interesting thing is that I think when people first start drinking, it's actually the depression of that prefrontal cortex that gives them that sense of invincibility and that buzz and just kind of knocks out that sense of judgment even. And so judgment and impulse control. And it just gradually depresses all of the other brain functions as well. Mhm. So alcohol is incredibly neurotoxic. And, as we kind of talk about removing alcohol as well as other illicit substances, as kind of first line treatments for so many of our patients, it really makes a tremendous difference. I ran a sober living home for adolescents for a number of years, and it's just a major change just with those transformations.
So what is, are there going to be other treatments that you're going to move forward with? When it
Yeah.
comes to, other than EMDR, are there any other things that you guys are working on when it comes to treatment?
So the interesting thing is that didn't want to overwhelm, but I do think that implementing things like cognitive behavioral therapy followed by EMDR to address the diamond would be really, really important. And then maybe considering other things, maybe non-pharmacological methods to improve that prefrontal cortex and the temporal lobe. Maybe utilizing things like neurofeedback could be extremely, extremely helpful.
Yeah.
Yeah. Mhm. Mhm. And, and I'll say this as well, as a physician, I prescribe medications all the time, but, being able to really take the time to show our patients exactly what their brains look like so that we can more responsibly prescribe and manage, I think is really such an important part of medicine. And at least for me, that missing component, that missing crucial component that, I probably did for 30 years. Mhm.
As far as, prescribing medications. Now, will you utilize like GeneSight or Tempest or something like that to understand a little bit how Anthony's body is metabolizing
Mhm.
those?
So that's in the list of recommendations as well. So, we do utilize genetic testing in a standard way. And again, I probably do that more than anybody. I mean, because I request genetic testing for everybody. And with the genetic testing, we're not looking at the entire DNA. We just focus on the pharmacokinetic genes in the body, which dictate how the liver metabolizes medications and even supplements, but especially medications. And we're able to look very carefully because not everybody metabolizes in the same way. And we're able to identify those patients who, you know, um, might not do well in treating depression with an SSRI. Um, and we actually, all of these medications that we prescribe, some of them come with black box warnings, may cause suicidal thoughts and behaviors, and we actually know who those people are. And so being able to tell them up front, this particular medication may be fine for Joe, but it's not okay for you. And that really makes a huge difference. Mhm.
Amanda has the question, and her question is, would you look at hormonal therapy like oxytocin nasal spray for the diamond pattern?
That's an excellent question. I don't know specifically, um, especially because Anthony is asymptomatic. Um, I do know that the studies show that EMDR is very, very effective. Um, but I don't think that I would recommend that unless someone was actually really having significant symptoms.
So his diamond pattern, which is the PTSD pattern, or
Correct,
the trauma
correct.
pattern,
Mhm.
he doesn't have symptoms of trauma or PTSD.
Correct. Mhm.
Yeah, so you're gonna, and I'm really glad you said that. Because I think it's important when I'm out in the field and talking with other providers, that's one of the things that I bring up, because some people have this misconception that the scans diagnose and the scans don't diagnose.
No,
It is you,
no.
the physician, that is diagnosing.
Mhm, mhm.
And so I love what you just said about the symptoms and the scans.
Right.
So, and they're not correlated.
Hmm.
Is there a reason for that?
Well, I think there's probably a number of reasons that probably differ depending on the individual. And one of those, and I think specifically it has to do with how people process emotions and feelings. Um, you know, if trauma occurs in early childhood, um, you know, we often utilize sometimes very primitive mechanisms of defense to help us to navigate that stress. And we may certainly use maladaptive patterns to deal with that, but we learn those very early on, and certainly suppression is one of them, which is why I think we see evidence of those physiological changes in the brain for an extended period of time. But my point is that for many of us, like Anthony, that's buried. And so I use the term excavation in kind of a literal sense because, we in a very careful way, in a very thoughtful way, we kind of look at those things, much like someone, when I think about an archaeological dig, that's always done very carefully. Uh, Instead of with um, a shovel, they use a toothbrush. And so, sometimes when these things are really significant and very deep, you have to be very careful. And so just kind of throwing medications and things like that can create suicidal thoughts and behaviors or changes in one's level of functioning is really not the prudent thing to do. I hope that makes sense. Mhm. Mhm.
A lot of therapists talk about when you open up someone's trauma,
Mhm.
you need to be able to close that trauma too.
Right,
And
right.
if it opens and it goes to places that person's not ready for, or they don't know what they don't know, that can be have consequences.
Yeah, and I certainly remember, decades ago, when psychiatry was perhaps not as ethical. Um, they would create these interactive weekends, these trauma therapy weekends where people would go and have these experiences that would trigger all kinds of trauma. And just hundreds of people ended up being hospitalized. Just in a very ridiculous way.
Well, my thoughts are just going in, so that's why it's so important that you explain. What's your first name?
Yeah.
Leo's role, getting the history
Yes.
to get a better diagnosis after seeing
Mhm.
all of this in the brain as well.
Right,
I
right.
think that's so good.
Mhm.
Makes so much more sense.
Oh, it does. It does. And when I think about, my own training, um, we've abandoned so much of that training to satisfy expedited medicine. You see somebody in 15 minutes and you're prescribing, life-altering medications. It's just ridiculous.
So, Dr. Johnson, I don't know if you have this or not, but if you do, can you show everyone the treatment plan with the phases?
Oh, sure. Okay.
Because one of the biggest things that I hear out in the field, or when I'm talking to providers, clients, the whole thing. In fact, I just had a conversation with a dad maybe a month ago, and he called me and was asking questions about his treatment plans for his son. And his son had ADD. And one of the things that he said is, I need to find another therapist. And I said, okay, let me ask you a question, because he didn't want to go down the medication route. I said, do you have the treatment plan in front of you? And he goes, yeah. And I said, okay. And I think it was one of your patients. And I
Okay.
said, now, on Dr. Johnson's treatment plan, did he mention neurofeedback for your son because he has ADHD? No, he didn't mention neurofeedback. No, he didn't mention it. And I was driving back from Arkansas and I'm on the phone with him and I'm like, okay, so what I want you to do is I want you to scroll down and I want you to go to, it's like the, page 15-ish, okay, because I didn't, have the number of pages. And I said, now, I want you to go down there. And he goes, oh, there it is. I said, that provider in San Antonio. And he goes, wonderful. So, part of the process, when people go through it, the treatment plan is, it can be overwhelming.
It is. It is. Yeah.
A managers like Leo, to do those follow-up appointments, to walk people through any of the questions that they have. And what can we do? Because it is overwhelming. And you may go back to that treatment plan a year from now or 2 years from now to look and see, okay, am I really doing all of it? And like you mentioned, Dr. Johnson, about it's really baby steps, and they're lifelong baby steps.
Yes,
You know?
yes.
And so I think just because it's, you mentioned ADD with Anthony. And neurofeedback could be one of the modalities. So, okay, now that you have that, hold up. If you could go through that, that would be great because it
Sure.
explains so many things and it helps with the questions not be overwhelming.
Right. And if I can offer this, I mean, you're absolutely right, Lisa Marie. It is really overwhelming. These reports typically end up being 20 plus pages. And um and probably the meat of it, I mean, the lion's share, I think Leo does. Leo and people like Patrick and the other Palms. I mean, they really spend that 2 hours in putting together that foundational information. But then afterwards, we put together, I mean, we have scan readers who are the radiologists that review all of the scans. I include all of that information. And actually, I go through and underline. Um, and in fact, I'll even share this with you. One of the nice things about um, the study findings is that the findings actually really highlight the most significant areas that we need to focus on. And then they offer a clinical correlation. And I actually go through and underline that, those areas that we talked about and those really salient features for each of the patients. And then I tried my best, again, after going through the clinical correlations, then I talked to them about the physician section, which actually begins here, which actually then kind of in phases talks about that treatment plan. And I tell people right now, let's just focus on phase one. And phase one is from a medical perspective or biological. We really want to kind of make sure that there's nothing toxic, metabolic, inflammatory, or even hormonal that might have an impact on overall brain health. And so, because of that, the next step is I put together a very detailed uh, blood panel. Okay. And even though that's highlighted, I actually then actually write it out and we actually have a list of all the lab tests. Now, I create a separate lab order to go with the patient, but it's all listed here, the lab work that we recommend. And to do it now, a comprehensive metabolic panel, including a CBC, um, lipid panel. I look at vitamin levels, C-reactive protein, homocysteine, a full thyroid panel, including thyroid antibodies, and even hormones. In this case, of course, male hormones. We look for things like Lyme testing, Epstein-Barr virus, cytomegalovirus, mold exposure, things like that, as well as pharmacogenetic testing. And for people that have already had blood work done before the scans, we actually have optimal levels for some of the key areas. And so I share all of that information depending on if they already had blood work. In fact, if they've had it, I actually in my appointment go through the blood work, what it means, and what things we need to, what action items are present. We put together other recommendations like, improving sleep and the quality of sleep. So these are very specific recommendations here. I put together recommendations for the supplements. Now, I put Brain and Body Power Max here, but if he's doing Bright Minds Memory Powder, we just substitute that. Okay. And it actually goes through in detail the components of that, especially the Bright Minds Memory Powder. I go through Focus and Energy and its components that we kind of talked about, all of these things. And I kind of highlight those for the patients. I included recommendations for Happy Saffron, and then more importantly, each of the components here, the saffron, curcumin, and the zinc, and how they would uniquely benefit his brain. And then also I included deep comfort sleep, which I think is really, really very helpful. The deep comfort sleep is 300 milligrams of L-theanine, 300 milligrams of magnesium plus GABA that really helps to facilitate sleep. But more importantly, especially the GABA, really targets those overactive parts of the brain so that it really becomes very, very helpful. And then we kind of look at nutritional. I put together a nutritional plan, which included, things like intermittent fasting, eliminating sugar, and especially with the diabetes. Let's see.
Oh, that's gone now.
Oh, yeah. Okay. Oh, excellent. See, all right, good deal. But still eliminating sugars, enjoying healthy fats. And we actually talk about this. And when teenagers, oh, this really gets a laugh. Uh, when we talk about eliminating sugar and replacing it with, nuts, nut butters, seed oils, omega-3 rich seafoods, things like that. And then another thing that I really emphasize is just boosting water intake. Makes such a huge difference. And the rule of thumb is really consuming about half of your body weight in ounces of water per day makes all the difference in terms of improving that blood flow and circulation to those key areas of the brain where there's low blood flow. Um, and then also with chronic illnesses like diabetes, a nutritional consult. And we have, wonderful people on the Amen team who are nutritionists that can really help here and facilitate that process. So I included that, an exercise plan, but one that actually really targets specific areas of the brain, like the prefrontal cortex, and these specific exercises, primarily aerobic, but also areas like when the basal ganglia are activated, things like yoga and Tai Chi that really help to target that. So those are things that I include, as well as mental exercises here, and even things like relaxation and mindfulness, meditation, and also I talk with them a lot about our Brain Fit for Life app, which is really very, very helpful in terms of brain health trackers, breathing exercises, interactive brain games, even things like guided meditation. So we go through all of those things. A social, spiritual plan. And in fact, on the spiritual plan, I really highlight this part that, encourages our patients to make a contract in identifying their motivation. You know, I'm making these changes because I value something very specific. And being able to identify that makes all the difference in the world. Okay. And it really becomes our why. And also things like, you know, actually for some reason I didn't include neurofeedback here, but I should have. Okay. So I'll modify that. But also recommended reading, including some very specific podcasts by Dr. Amen. And I talk about those and how beneficial those are.
And then can you go to phase 2?
Okay.
This is where people get into the weeds so they start on phase 1.
Right.
They could be weeks, it could be months for phase 1. I mean,
Right. And in phase 2, let's see if I can do this right. Yeah. And, the psychological health, starting with the cognitive behavioral therapy. And I think doing CBT first, and then when someone has those skills down, then proceeding with something like EMDR.
Yeah, with somatic experience.
Exactly. Right. Mhm.
And then would you recommend for Anthony, we had a couple questions. Okay. Would you recommend a sleep study for him?
So, yes. Mhm.
I have a question. Do you have a picture of a brain that would need Adderall?
Well, the interesting thing is that if you only look at the prefrontal cortex for Anthony, you would say that's a brain that needs Adderall. And while I think that that's true, when we look at the limbic structures, that takes away that recommendation. Because while the Adderall, and don't get me wrong, Adderall can be very helpful for a lot of people if we just need that help on the prefrontal cortex. But even though Adderall can be very, very helpful, it can really exacerbate mood and anxiety symptoms.
So you hear stories about people who go on Adderall and they kind of lose their mind.
Well, I mean, that's one of them. And unfortunately, just this week, I mean, I see them all the time, but people who really abuse stimulants. I mean, they're not just taking a 10 milligram tablet of Adderall. I mean, these are people that are, unfortunately, I have one patient that, I mean, he's come to me now to look for alternative treatments for his lack of attention and focus because he was abusing Vyvanse for so many years. He would get a prescription, a 1 month supply, and go through it in less than a week. Yeah. And while I think that that's certainly an example of the abuse, there are other people that really do some horrific things. I mean, it's amazing, the availability of stimulants over the internet. I mean, it's just, and then when we think about things like Kratom that are sold in gas stations, I mean, it just blows the mind.
We're seeing a lot of trading drugs,
Hmm.
which is really sad. And it's so highly addictive
Oh, it really is.
that I have a lot talking about people in the addiction space, and they're having to put those patients on Suboxone.
Right, right. I mean, it's like a legal opiate.
Because they're so addicted to Kratom. So they're
Yeah.
putting on, Suboxone or methadone. No.
Mhm.
Now, I did hear that they are looking at making Kratom a Schedule I controlled substance. And so they're pushing for that, because right now it's not scheduled.
I can't imagine why anyone would prescribe it.
Well, it's interesting because I had posted something on LinkedIn when Dr. Amen did the before and after scans of the LA news anchor and her producer.
Right, right.
Okay, which was awesome. And he had scanned the brain in May of 2024 and then rescanned in May of 2025. And her brain, she had ADHD and she liked to have her cocktails, and little things like that. But she followed what Dr. Amen says. She didn't completely eliminate alcohol, but she cut way back. She did neurofeedback. She was taking supplements. And a year later, her brain got better like Anthony's. Okay, Anthony's brain looks amazing, even though some of his, limbic system is low. And then her producer's brain. He was supposed to do hyperbaric, which he did. He did actually everything that Dr. Amen told him to do, but he did not disclose to Dr. Amen that he was using Kratom.
Right.
And his brain got worse
Hmm.
after doing all of that. And so I can't wait to see what his brain looks like, a year from now after being off. Because it is, the emergency rooms are seeing more and more of this with the CBD gummies with THC and Kratom.
Right, right.
They're seeing it daily,
Hmm.
nightly. Yeah, it just blows me. So with phase 2 or phase 3,
Okay. And phase 3 really looks at the social and spiritual components that we kind of highlighted. kind of timed out again. Sorry about that. All right. So I've highlighted phase 3 here. And again, from a social, spiritual basis. And these are really, really very crucial elements. And I think that Anthony has spoken really, I think, quite well regarding the impact of really that social support network. And again, luckily, at the Amen Clinic, we, gosh, probably have that, I think, in such great abundance that just doesn't exist in many other workplaces.
I agree.
Thanks to our great leadership from Kristen.
Brain app, you kind of that app and the headset.
Right.
How do you feel about that? Like, I've been acoustic therapy.
So I've never used that. Does anyone else have experience with the brain tap, or what is your experience?
I've been acoustic
Mm-hmm.
way on it, anywhere from 30 minutes to an hour, and there's different programs they use. It's
Is it like neural stimulation? Okay. Mm-hmm.
started looking into this headset where it has different programs, and they said like over 120 different studies with cognitive decline, and really have seen great improvement. And I said, I just started looking into it, so I don't know that much about it, but you listen to the different programming, this like sound therapy, and then there's piece that goes over your eyes, so it's got red light and blue light.
Okay.
LEDs that go in your eyes and your ears. I don't know if y'all have used anything like that.
So is it specifically for cognitive decline, or is it used for other things as well? Different things, like ADHD, is it like a neurofeedback?
Kind of, I mean, it's just basically, like, go through the program.
They had a tap before, I've seen brain tap.
But it's like there's different programs that you can choose for different things. Like they said, they've been really successful with helping people with weight loss and stuff.
Oh, I know all of us go, oh. Does anyone online have any more questions? Amanda, Nimisha? Kimberly? Hey, Samantha.
I had a question for Anthony. Before you started this church, how did you feel compared to how you feel now?
Man, I was just talking about this at the barbershop too as well. Just like the everyday like activities, from just tying your shoe to things like that, it's just like a whole different feeling. Like when I started off, I had a hard time breathing. I mean, I couldn't sleep through the night. I used to have to either sleep like sitting up like this or sleep on my knees over the bed just so I could be able to breathe. I used to come to work, eyes bloodshot red, not from drinking anything like that, just because from the lack of oxygen going to my brain and not being able to sleep. So where at times I used to be, luckily I was real good at my job. I used to be kind of like nodding off, but they seem like you seen everybody caring for me, like, hey, are you okay? Get up, maybe walk around a little bit. But to now just having like a tremendous amount of energy, I just went back to the amusement park for the first time in 15 years and was able to get on the ride. So it's just everyday activities I took for granted at first. I mean, I feel awesome. So that's why I'm going. Like, I know my family probably get tired of me because I'm pushing Aiming Clinic so much, I might be out somewhere. I'm talking about supplements and things like that and eating healthy when I'm here. Like, you want to shake? Hey, that ain't aiming to prove, hey, what's going on. I'm on them because I feel good now. Before, I used to want somebody to be unhealthy, like go get the McDonald's, we go eat it over here. So it's just, yeah, it's a great feeling, just turning all the way around. And that's what keeps me going, just being praised for the everyday victories, like, and that's what we promote here as well too, in one of the non-negotiables, like just those small victories, keeps us going and also the patient going. So when I walk in, I hear, Anthony, you're doing good. It makes me want to, keep on doing good, even when nobody's looking. I'm gonna keep on making these shakes and taking these supplements. You want some of this too, so.
Well, I appreciate you sharing your time you had and how you started.
Yes, ma'am.
Y'all are 1 mile 3 times a week, which is great, and I wanted you to share your shake one more time. What you do
Oh,
with the
so
greens?
for the shake,
Yeah.
depending on how you like it, I started doing the vanilla powder, and then we had the sugar-free almond milk here. And then also, if I wanted, like, to hold me through the morning, I'll add a banana to it as well too. If not, I'll keep it like that. But also, I'll put a scoop of the Nora greens in it too as well. And I ain't gonna, to be honest with you, the Nora greens, the scoop of that mixed with the chocolate protein powder, it's a good combination. Now, I promise you. No, I promise that our chocolate protein, 1 scoop of that, about 10 ounces of almond milk, and then a scoop of the Nora greens, and you can throw some cubes of ice in there to blend it all up, or you can put it over some ice. I promise you, it tastes as good. It's delicious. It's gonna get you through it. It's gonna get you through it. It's gonna get you through it. I promise. If not, you can just do the regular. I didn't like just doing the regular water and the Nora greens, but when I did so that's what I'm saying. The Nora greens, almond milk, protein, chocolate protein for that. Delicious.
Actually, I think that recipe is going to help me a great deal. I I have one little boy. He's about, he's about 7 or 8 years old, and he came back for his follow-up visit, and he said, I will eat every vegetable you put in front of me as long as I don't have to eat those greens.
It's not bad. Do it like that. First, I didn't like it. First, when I got it set for a little bit, I said, I gotta figure out a way to use this, because this is giving me all my greens in one sit, all my veggies
Oh,
I need.
that's great. That's
So
great.
once I did it like that, I'm good.
I do love the Bright Minds memory powder. I usually kind of start with a frozen banana because I think that changes the texture and it's very creamy like an ice cream. But I blended with that and it's really good. And my favorite is the orange mango. We have a blueberry lemon that's pretty good, but the orange mango is really, really great.
Yeah, do it.
Mhm.
Have you tried them?
Not yet.
Mhm.
We just put some in the break room for everybody to use now.
Yeah, we need to start putting some frozen bananas in there.
You just buy bananas and freeze it.
Yes, that's it. You just peel them and free. Yeah, exactly. Yeah.
Any other questions?
Any other questions online?
I'm like an hour and a half from here, so.
Oh, in Gun Barrel City. Yes. Mhm.
How, to refer patients there, I told it to different people about it here and told them to come to learn more. And I've done a little bit of research, but how does the whole process start? Like, if I refer them, they just call and.
Right. We actually have a call center, and that's the first step. And they really walk them through the entire process. And patients can even schedule um, kind of a planning conference, and all of the doctors do them. But we actually schedule 30 minutes just to talk about the full process, what to expect, that anticipation, but also to kind of help to screen patients who might need additional services.
I
Mhm.
did the call from myself and talked
Mhm.
to someone, and she kind of told me, the price and of course, cash pay, but y'all do accept insurance, some insurances, but
So it is cash pay, but we also are able to help people file on their insurances. And even the physicians can even go through an appeal process to kind of help to facilitate that.
And Sandy, so for providers, sorry. So for providers like you, we have a concierge scheduling link. Okay, and that's something that I can give you. And whether you're looking for yourself or you're looking for one of your patients. And so that concierge scheduling link, here's what I love about that. First of all, we know the referrals coming from you. Okay, and there are drop-down menus that will say, the patient's name, the patient's email, it has a place to put your information in, but it also says, what are you referring for? Well, are you referring for a 1-scan evaluation, a 2-scan evaluation, or in your case, as you and I talked about, we can work with you a little bit differently because you are a prescribing provider. And so we can talk more about that. So it'll say, spec scan only for prescribing providers. It'll say, like Dr. Johnson mentioned, where you can do a consultation with either the doctor or one of our nurse practitioners. And so you list it out that way. Then what happens is it goes through our system. I get it. And Anita, our concierge scheduling assistant, she gets it. And then she can follow up with that patient. And this way we know where it's coming from, because what we want to do is we want to be able to coordinate care with you. So
Yes.
do we want to get a consent signed? Do you want to be a part of the process? Would you like to shadow the evaluation with Dr. Johnson or Dr. Sanger or Dr. Lichardi? Because we encourage that. We encourage our collaborating partners to shadow if they want to. Because you guys are going to pick up on things that the patient is not going to pick up on. And 9 out of 10 times, you guys are going to be implementing the plan that Dr. Johnson has created.
Right, right.
And so that's where that's important. So, or the other thing is you can text me. Okay, and if you text me, then I can make sure that you're taken care of. A lot of times I don't talk to your patients or clients directly, but sometimes I do. Okay, so sometimes I do where let's say I had a referral partner up in Oklahoma City, and he wanted me to meet with him and his client via Zoom. So I did. I spent an hour with this client of his, and this client is going to come in. And so we were able to talk through things that maybe some of our care centers, they don't know, some of our employees, not because they don't want to know, but it's just not their role. I get to have different conversations with people all day, every day. So I have, different, things that I can draw on. So with this particular patient, the other thing is that I get into, okay, who is the patient? What's their background? Are they going to do well with a male? Are they going to do better with a female? What are their personalities like? Is that important to them? For some people, that's not important. They could see any doctor, it doesn't matter. But for some, that is important. Are they more comfortable with someone that's direct? Okay, if they are, then we have our go-to person for somebody like that. So that's where we can kind of get an idea of who's going to be the best fit for them. So I hope that helps.
yes, oh,
Okay.
definitely. As far as the supplements and things that y'all are talking about, do you have to be like a patient or a client to get that, or is that something?
Oh, no, they're available on our website, the BrainMD website. And in fact, even on Amazon, even though I wouldn't recommend that. I would, directly from the website is the best way.
I'm glad you brought up the supplement because as Tasha knows, she is a BrainMD affiliate partner. And so in her coaching practice, she can share links with her clients that she's coaching where they can buy the supplements from those links. Or you can become a BrainMD wholesale partner where you can actually purchase the supplements for 40% off and you can resell them in your clinic for retail. So there's two ways that you can do that. Or like Dr. Johnson said, you can just order on brainmd.com and order them that way. So, and if you do want to become a wholesale partner, then you and I can talk about that. Because that's simple. The affiliate, I mean, you deal with the affiliate all day long. Is it easy for you?
Very easy.
Okay. Yeah. And then for other physicians and or nurse practitioners like you may already be working with FullScript. And if you're working with FullScript, the BrainMD catalog is on FullScript. Yeah. So not all of it, but most of it's on FullScript. So you can use it that way too with your patients. Any other question? Okay, this is where I think so.
Gosh, well, I really appreciate everyone's attention this evening and those very thoughtful questions and your continued support of the Amen Clinic as we try to kind of support all of our patients. Okay. Okay. Thank you. Mhm.
Okay, thanks you guys. Have a great night.